Hi, today we are going to talk about knee pain. What could be causing my knee pain is one of the common questions that we get. So, of course, depends on the history. If you've actually hurt your knee while you're playing a sport or a specific activity where you've tweaked it and it's an acute injury that you've got it since a certain period of a time and certain type of an incident, then it's a soft tissue injury or an injury to your muscle, ligaments, bones, joint that you'd want to explore more, which we can talk about later in this video. And then second is if this is a gradual onset of a pain, that means it started one off slowly and then gradually it has started to get worse, or it has kind of stayed with you and then has a pattern of doing certain movements for a period of time and then you get sore or that specific movement actually hurts. Then these become into a subacute chronic sort of an injury, and that could be some dysfunction or a derangement problem. That means the bones and the joint is not functioning as well mechanically, and it could be a patellofemoral pain syndrome, IT band syndrome, and other sort of a syndrome condition that you could be having. Now, second question to ask is, what does the pain feel like? So if it's a dull, achy, nagging sort of a pain, again, if you've been diagnosed with arthritis, then and you're feeling a lot more stiff and tight, then it could be attributed towards that. But if you have a dull, nagging pain just around the kneecap area, then it could be patellofemoral pain syndrome. If it's a tender pain just around the lower part of the kneecap, then it could be a quadriceps tendon or a patellar tendon problem where you are experiencing a lot of pain while you are jumping or being able to extend your leg. Another, if at all you're experiencing a locking, popping, sort of a clicking pain, and then with some swelling, and if it is associated with a trauma, then it could be a soft tissue injury like a meniscus problem. Meniscus is a shock absorber that stays between the knees, and it's very important for the health of the knee to be able to create stability. And if we and the knee and if the one of the common symptoms that a person could say is that my knee could give away, or then it would just lock abruptly in certain position. If at all you are experiencing instability around that knee while jumping off a step or while jogging, then it could be some ligament instability, again associated with a certain trauma, or some overuse injury as well at times. So what should you do when your knee hurts? Of course, you need to have it checked by a health professional. But then sometimes we don't know. Do we go to a family doctor? Do we have to book an appointment with a sports specialist or a sports medicine doctor or an orthopedic surgeon, or you could come directly to a physiotherapist or another clinician. So a lot of factors would dictate that. However, if your pain is a mechanical in nature and something which is going on for a gradual period of time, over a period of time, then in most cases you could just directly be seeing a physiotherapist so that they can assess and then be able to let you know what's the right course of action. If at all you've had a trauma and an acute injury, and one important thing is to rule out if there is no fracture. So one way to rule out fracture, which most at urgent care that people do, again, this is not a test to be able to do it yourself. However, it's nice to be educated about it, right? If you are having some point tenderness just around your kneecap, or if you are around this outside part of the bone, a fibula, head up there, if you are having some tenderness around that area, if you are unable to put any weight on that leg, or you are able to step down, or no more than 4 steps is all what you are able to walk, these are some signs that you could be having a fracture. Or sometimes if the kneecap is actually shifted on one direction that you can visibly see, could be a dislocation or things of that nature. So you definitely want to have it screened by a doctor, and then have some x-ray be done to ensure that you get the right treatment intervention in a right period of time. But during those times, it's important that you're keeping it immobile, or doing some rest compression, eyes elevation, sort of a rise protocol. And that's for fracture. But in other cases, if it's a soft tissue injuries, that means you do not have those symptoms, but again you are having these locking feeling in the knee, or the knee is starting to give away, or then you are having issues walking, stepping, then you definitely want to have your movement be assessed, and movement physical examination could be done by a physiotherapist. At times people tend to think that they would need an MRI or an ultrasound or lots of imaging before they see a physiotherapist. That necessarily has to be that way. In fact, there's a lot of physical examination that could be done, and if needed, we could be sending you for some imaging if we need more information more information. And most times where we would need an MRI, so a common question gets asked that, do I need an X-ray, do I need an MRI? As much the evidence suggests that 90% of the time a knee X-ray doesn't necessarily dictates the way that the knee actually gets treated. So unless it's a fracture or a dislocation, more often than not, the knee X-rays are not as helpful. Now, do you need an MRI? Of course, the extent of the soft tissue injury, an MRI actually allows a person to know whether do they need a surgery, or can this person be treated through a conservative approach. And if at all you've had a failed bout of a rehab, that means you've been getting something treated for 3 to 6 months and haven't recovered, or you've had some residual problem where the knee still tends to give away or has instability, and you have the history of this ACL injury or a meniscus problem, then an MRI could be warranted. And sometimes in extreme cases, a bucket handle tear, that means just another form of an meniscus tear, that will dictate that this person needs a surgery or not, and that will necessitate an MRI referral.